Welcome to Bookread XYZ. We're excited to have you here, where we bring you the best summaries of medical books. Today, we'll be diving into a detailed 20-minute summary of Stoelting's Pharmacology and Physiology in Anesthetic Practice 6th edition. Make sure to follow and like our page for more insightful summaries and medical resources. Introduction to the book. Stoelting's Pharmacology and Physiology in Anesthetic Practice 6th edition is an authoritative guide that blends the essential principles of pharmacology and physiology, tailored specifically to the practice of anesthesiology. This edition is updated with the latest information, providing a deep understanding of drug action, physiological effects, and how these apply to anesthetic practice. Overview of key sections. 1. General pharmacological principles. The book begins with foundational concepts of pharmacology, including pharmacokinetics, absorption, distribution, metabolism, and excretion of anesthetic drugs, pharmacodynamics, drug receptor interactions, and the physiological outcomes of these interactions, mechanisms of drug action, detailed explanations on how different anesthetic drugs alter cellular functions and their overall impact on patient outcomes. Key takeaway: understanding these principles is crucial for anesthetists to ensure optimal patient care during surgery, minimizing risks, and achieving the desired anesthetic state. 2. Autonomic nervous system and anesthesia. This section explains how anesthesia affects the autonomic nervous system, ANS. It provides insights into sympathetic and parasympathetic system regulation, the use of adrenergic and cholinergic agents during anesthesia, impact of these systems on cardiovascular and respiratory function during anesthetic administration. Key takeaway: mastery of ANS pharmacology is essential for managing intraoperative and postoperative autonomic responses, such as blood pressure and heart rate control. 3. Cardiovascular pharmacology in anesthesia. This section dives into the effects of anesthetic agents on the heart and blood vessels, including the pharmacologic management of patients with cardiovascular diseases, drug classes like beta blockers, calcium channel blockers, and inotropes, and their application in anesthesia, effects of volatile and intravenous anesthetics on cardiac output, heart rate, and blood pressure. Key takeaway: anesthetists need to balance anesthetic depth with cardiovascular stability, especially in patients with pre-existing cardiac conditions. 4. Respiratory system and anesthesia. Respiratory physiology, in the context of anesthesia, is covered comprehensively. Effects of anesthetic agents on gas exchange and ventilation. The pharmacological management of respiratory complications, such as bronchospasm or hypoxia. Use of neuromuscular blockers and their impact on respiratory muscles during surgery. Key takeaway: proper understanding of how anesthetics influence respiratory physiology helps prevent postoperative pulmonary complications, ensuring patient safety. 5. Central nervous system pharmacology. This section details how anesthetic drugs interact with the central nervous system, CNS. Mechanisms of action of general anesthetics at the neuronal level, pain modulation, and the pharmacology of analgesics, including opioids, NSAIDs, and local anesthetics, drugs affecting consciousness, amnesia, and sedation. Key takeaway: CNS pharmacology is critical for achieving balanced anesthesia, providing adequate pain relief while maintaining patient consciousness as needed. 6. Neuromuscular blocking agents. Detailed exploration of neuromuscular blockade used in surgery. How drugs like succinylcholine and rocuronium work to facilitate intubation and muscle relaxation. Reversal agents like neostigmine and sigamidex and their pharmacokinetic properties. Key takeaway: accurate dosing and reversal of neuromuscular blockers are key in ensuring patient recovery and preventing residual paralysis post-surgery. 7. Renal and hepatic pharmacology in anesthesia. The renal and hepatic system's role in drug metabolism and clearance is crucial for anesthetists. Understanding drug dosing in patients with renal or hepatic impairments. The impact of anesthesia on renal blood flow and liver function. Specific considerations for nephrotoxic and hepatotoxic drugs used during surgery. Key takeaway: dosing adjustments and careful monitoring of drug effects are necessary for patients with compromised kidney or liver function. 8. Endocrine and metabolic effects. Anesthesia can affect metabolic and endocrine systems, particularly glucose metabolism and management of diabetic patients, thyroid and adrenal function during surgery, the use of corticosteroids and their effects on immune and inflammatory responses. Key takeaway: patients with endocrine disorders require tailored anesthetic plans to avoid metabolic imbalances and surgical complications. 9. Anesthetic drug interactions. The book discusses drug-drug interactions during anesthesia, synergistic and antagonistic effects between anesthetics and other medications the patient might be taking, how to manage interactions with anticoagulants, antihypertensives, and sedatives, importance of medication reconciliation pre-surgery. Key takeaway: safe anesthetic practice involves understanding potential interactions to prevent adverse effects during and after surgery. 10. Special considerations in pediatric and geriatric anesthesia. Pediatric patients have different pharmacokinetic profiles, requiring special dosing and drug selection. Geriatric patients often have comorbidities that necessitate adjustments in anesthetic care. The book highlights key drugs and dosages appropriate for both populations. Key takeaway: age-related physiological changes influence drug metabolism and clearance, which anesthetists must account for when planning anesthetic care. Conclusion: Stoelting's Pharmacology and Physiology in Anesthetic Practice, 6th edition, is an indispensable resource for anesthetists who wish to deepen their knowledge of how pharmacology and physiology intersect in their practice. From understanding the effects of anesthetic agents on various systems to managing drug interactions and special populations, this book provides a comprehensive guide to safe and effective anesthesia. Key message: mastery of the pharmacological and physiological principles discussed in this book will equip anesthetists to provide the highest standard of care, ensuring patient safety and optimal outcomes. Thank you for joining us today for this summary. Don't forget to follow and like Bookread.xyz for more insightful medical book reviews and summaries tailored just for you.